My name is Dr. Eva Quiroz, and I'm an infectious disease specialist here at LewisGale Medical Center. The interesting aspect of my specialty in infectious disease is that I get to work with every single subspecialist in medicine. So with internal medicine, they might consult me to treat someone who has a very bad flu and developed a superimposed bacterial infection, or a complicated bladder infection. With the neurologist, they might have a case of meningitis or encephalitis, and they might need my help in making a diagnosis and treating that specific condition. The cardiologist usually would consult us to treat endocarditis or other complications of vascular diseases or infections. The nephrologist for complicated bladder infections or kidney stones that have developed a biofilm, which is bacterial infection that is hard to treat. The gynecologist might call us for complications during delivery and development of infections or sepsis. So in essence, it's an honor to be able to serve people and to work with different groups and different doctors in the community to help in the healing process. It's important to have a team approach in treating patients and to be able to work in collaboration and trust each other and being able to obtain more information in order to help the patient heal quicker. I am hoping to bring knowledge, caring, compassion, and my love to the community, and being able to serve and work in collaboration with the whole team. My personal approach to medical care and providing medical care is to consider my patient's history, listen, understand, and collaborate. My goal as a healer is to be able to understand sort of every aspect of my patient's life so that I could make a correct diagnosis and then share that diagnosis with my patient and then get their feedback. Because I think an important part of the healing process is for the patient to understand. Psychosocial aspect of medicine is very important because without that you don't get the whole picture of why someone is sick. So someone could get immune compromise and develop an infection because of other things happening in their lives. It's important to get the whole history and then to have the patient have the confidence to ask questions and then share information and then come up with a plan and diagnosis and treatment. I would like to be involved with the community in terms of education and what you can do to stay healthy. And I think that people are already thinking about that. They're already thinking about, I don't want to take antibiotics or medications for hypertension and other chronic conditions. What can I do to improve my health? It's important to learn about those different aspects of how to use nutrition for health, how to increase activity to feel better and to prevent disease. Some things are because of our family history or genetics, and then there's some things that are our emotions and how they affect us and how we get immune compromised when we're stressed out. Or sleep. We can learn that sleep deprivation can cause illness because you're immune compromised. If you're not sleeping, your body cannot recover, and then you're at higher risk of developing disease. Looking at all of that together and then helping people think about it and see what they can do to prevent disease and how they can report symptoms earlier on are important aspects of general health care that I hope to share with the community. As a physician, I have the opportunity to connect with people at a different level, which is a humbling experience, and it's an honor to be able to hold people's heart and be able to help them in their times of need when they're more vulnerable, when you're sick and you don't know what to do, but you're sharing. That's an honor to me, and that's why I became a doctor. And my hope is to be able to serve and be able to help people in their time of need. And that is my deepest satisfaction, is to be able to serve.